When children's hospitals around the country make news, it seems that Children's Hospital of Philadelphia is always at the top. U.S. News and World Report has ranked CHOP the best in the country. The doctors and the patients say this, that their relationship and the CHOP commitment to changing lives is the reason why. Take a look at 2-year-old Jennifer with her doctor, Scott Adzick, in 1995. Jennifer was diagnosed then with a rare liver tumor. Dr. Adzick was her surgeon. And here, 20 years later, are Jennifer and Dr. Adzick. And not only did Jennifer get better, she has thrived. She is now a nurse, and she wants to practice in pediatric oncology at CHOP. Jennifer and Dr. Adzick join us now live to tell us about this truly wonderful place that we call CHOP. It's great to have you both with us. You are a great inspiration.
Thank you.
So, I mean, it's emotional to think about it, isn't it? Even all of these years later. I mean, doctor, when you look at her, because she can barely speak now, she's tearing up. When you look at her, what do you think?
This is my star patient here. Look at her, and you just wonder, right?
Well, she's very, very special. But when you look at a success story like this, what does that say to you about the work you do and the work that CHOP does?
Well, CHOP is a busy place. As far as surgery goes, we have 80 pediatric surgical specialists. We do 26,000 operations a year. That's about 100 a day. And there are, fortunately, many miracles like Jennifer. So, you know, C. Everett Koop, who was my predecessor as surgeon-in-chief at CHOP, said that when you save the life of a child, you save a lifetime, and there you go.
And so you save a lifetime, and a lifetime that you want to use. So tell me about your interest in pediatric oncology as a nurse practitioner.
Absolutely. Well, when I was in treatment, all of the doctors and nurses at CHOP were just so wonderful, not only treating me, but just recognizing that the whole family is affected when the child is sick. And so the support that my parents got from everyone there just really meant a lot to us. And so I can't imagine doing anything other than being a pediatric oncology nurse now, and hopefully just using my experience to help other families who are going through that.
It's a tough thing. I mean, you obviously have done some practicums already, you know, in the oncology unit. Mm-hmm. How difficult is that? I mean, emotionally, as you look at these little children who are suffering so.
It is hard, and sometimes I look at the patients and think that was me. But I know that a lot of them will get better. Some of them won't, sadly, but if I can just have a small impact on their lives while they're in treatment and help their family in some small way, that to me is worth it. And being back at CHOP for clinical was like coming full circle. It was almost like being home again.
And so what is it really, though, doctor, that sets CHOP apart from so many others? Because there are some other fine institutions across the country that are healing children.
There are. I view it as there is just layers and layers of expertise at all levels, whether it's 2 a.m. or 2 p.m. There's an intrinsic, well-groomed passion for excellence that permeates throughout CHOP, and that's pretty difficult to recapitulate. It is a very, very special place.
Yeah, well, we certainly do know that. Makes me want to tear up too. You know, you think about all the children who have been helped so much over so many years, and the great work that you do and that you're going to do.
And progress is going to be made. You said you want to help a little bit. You're going to help tons, okay? And when you think about the problem you had, which is in the rearview mirror, hepatoblastoma, a malignant liver tumor, age 2. In the 70s, the survival rate was about 35%. Now, with multidisciplinary care, it approaches 90%. So
spectacular.
Yeah.
Right. Thank you both. Thanks so
you.
much. So for more on Children's Hospital of Philadelphia and the work that they do, you can go to cbsphilly.com/talkphilly. Coming right back.